Knowing the risks and benefits of hormone replacement therapy is crucial for making your decision. Let's talk about what we do. I want to really share with you options because I don't think that the traditional system does a very good job in assessing these risks and individualizing them for you. And I want you to know it's possible. Missing for sure in the conventional framework is the time factor. You cannot assess these risks properly in a 10-minute assessment. We spend significant time with our new patients, over an hour. In fact, most of our appointments are over an hour because I believe that it's that important to get to know the person and what their desires are and what their family is and what their exposures are, and then be able to decide the best testing to do and interpret the test with optimum versus normal range, and then give someone guidance on what might be best for them. So we look at cardiovascular health, gut health, family history, desires, risk factors that could put you at increased risk for heart disease. Because if someone has pre-existing heart disease, we need to get that under control before we start hormones. And honestly, if someone comes in with major toxic exposures and chronic fatigue syndrome or feeling horrible, that's a real sign of rusty locks, and hormone replacement therapy is not step one. We need to clean that up first. But for the woman who's coming in late 40s, early 50s, and feels like something massively changed in her life with the cessation of her periods, it's pretty easy to make the decision that hormone replacement therapy is worth a try. But let's talk about how we do the risk assessment. Breast cancer risk. We look at family history. Is there a strong family history of breast cancer? Is there a personal history of breast cancer? Have you had breast imaging done? Mammogram is the traditional. Some women do ultrasound only. Some women do thermograms. It's not up to me to decide what you feel comfortable with and what you want for your breast imaging. And at Vitality Renewal, we offer quantitative transmission, QT imaging. Breast acoustic CT is another thing that it's known as. It's true 3D imaging where you can get a very good views of the breasts. So for women who don't want radiation or afraid of pain with mammograms, this is an option. I don't want people burying their head in the sand and not knowing what things are because of fear. And if they have a breast mass that's being evaluated, don't start hormones until that's figured out. And is breast cancer history truly a risk for hormone replacement therapy? That's a very nuanced conversation. I can't give individual advice here, but I can tell you it's worth a conversation with a knowledgeable provider. I honestly do not believe that estrogen causes cancer. You've had estrogen your whole life starting in puberty, and you didn't get cancer until you were in your 60s. Toxins, poor nutrition, stress that impede your body's ability to heal, that's what causes cancer, not estrogen. But if you have poor estrogen metabolism, then it does potentially make things harder. And until we clean those other things up, if you have pre-existing cancer that has hormone receptors on it, estrogen positive breast cancer, it will make it grow faster. So that doesn't mean it caused the cancer, but it could make it grow faster. And those are all important things to know. Once I have a woman on hormones, we monitor hormone metabolism in a urine hormone study. And that is incredibly important because one of the components of safe hormone therapy is how well you metabolize your estrogen. And if you metabolize your estrogen down a risky pathway, then it does potentially increase your risk of estrogen-related cancers. And we would want to have information on that and be able to take steps to protect you from it. Moving on to cardiovascular disease. How do we assess it? There's a few things to understand here. One is the only way to know for sure what your cardiovascular risk is, if you're at risk for a heart attack, is an angiogram, where they put a catheter into your femoral artery in your groin, thread it into your cardiac vessels, and then inject dye and take an x-ray to see if the blood vessels are narrowed. That's the only way to know for sure. Every other test that medicine does is a guess. It's an educated guess, and it puts you at what we call low risk or high risk, but it's just a guess. And one thing we know for sure is that the prediction of using a lipid panel is really lousy. Even the lipid panel that includes HDL, LDL, triglycerides, and total cholesterol, that misses 50% of heart attacks. So it's not a good indicator. Heart disease is an inflammation problem. So the testing that we do in our practice is very thorough. We do an advanced lipid test that looks at particle number and something called Lp(a), which is a kind of cholesterol that's easily oxidized. And then we look at cardiovascular inflammation markers, highly sensitive CRP, C-reactive protein. ADMA is asymmetric dimethylarginine. That's a marker for actual existing blood vessel inflammation and injury. Myeloperoxidase, oxidized LDL. Those are very well-studied markers that we can use to see if you have actual cardiovascular disease already. And if you do, I may not start you on hormones right away. I may work with you on optimizing your micronutrients, cleaning up your diet, fixing your gut, getting rid of inflammation, decreasing your risk of heart attack, because the last thing I want to do is ignore the number one cause of death, give you hormones and help you feel better, and then find out a month later from your husband that you died of a heart attack. I'm not doing you any favors. We need to look at the whole picture, and that's what we do. And that's actually a little of a side note, but it's one of the risks right now that makes me a little trepidatious about the tendency of so many providers now getting into hormone replacement therapy, is that, you know, you may have a bunch of clinics popping up that, oh, we're experts in hormones, and handing out a lot of prescriptions. But if they're not looking at the whole picture and making sure that you have keys and functioning locks, they're not doing you a favor. You need the whole picture. You need to start with making sure that you don't have rusty locks or your keys aren't going to work.